Good afternoon and welcome. Thank you for joining us, and I want to thank our County Executive, George Latimer, for the opportunity to be with you today to discuss the importance of flu vaccine in children. I'm also grateful that we have with us the Westchester County Board of Health President, Dr. Rob Baker, and his family who are with us today. And we also want to thank Dr. Patricia Avocado and her colleagues at Westchester Park Pediatrics and Bridgespan Medicine for hosting us today. And again, we have our special guests with us, and we want to give special thanks to Sophia and Aaron Baker, who are going to be so brave today and set an example for us by agreeing to get their flu shot on camera. I mean, getting your flu shot at that age could be scary enough. Doing it on camera, I think they get extra points for being very, very brave today. So by getting a flu shot, you protect yourself, but more importantly, you protect everyone around you, all the people that you love and care about. And so getting a flu shot is a very, very important thing for people to do. And with the COVID pandemic that we are still in the midst of, it's still putting a major strain on our healthcare system. And it is a risk to all of us. And so it's very important that we get our flu shot, even more than in previous years, because the symptoms of influenza, a cough, a sore throat, a fever, kind of having muscle aches and pains, are almost the exact same symptoms that a person might experience with COVID-19. So if you have these symptoms and you've not had a flu shot, it can cause diagnostic confusion for the healthcare provider trying to take care of you. Do you have influenza? Do you have COVID? And what could happen if it is COVID versus influenza is totally different. Influenza does not require a person to go into isolation. COVID, being positive for COVID, will require that person to be in isolation for 10 days. So it's very important that we be able to differentiate these things, and the sooner we can do that, the better. So getting a flu shot, as I said, enables us to more accurately diagnose what's going on with you, and it can make it very much easier for your doctor. So getting children a flu shot is something that not everyone thinks about. It seems that most people realize that older people, older Americans, people over 65 are at risk for bad outcome if they get the flu. But very few people really give consideration to the fact that children can get quite sick if they get influenza, and in fact, they could die. So it's very, very important that we get all of our children, everyone that we love and care about, whether they're 65 and older or very young, that we get them their flu shot, and the earlier the better. So one single flu shot will provide protection to you during the entire flu season. It is not too early to get your flu shot now. In fact, it's actually the perfect time. And even if it doesn't prevent you from getting influenza, because you could be incubating the disease if you've been exposed, and if you're incubating, getting a flu shot won't prevent you from getting influenza, but it might reduce the severity of the disease. So that's a very important point. And also, I'm constantly asked by people, or they tell me that they got the flu from their flu shot. What we give is primarily a dead vaccine. It's not a live vaccine. They're using live virus to produce it. So it can't possibly give you influenza from getting the shot. But as I said before, if you were already exposed and you're incubating, you could go on to develop the disease, but you didn't get it from your flu shot. So far this season, there's been very little flu activity. I think largely because people are wearing the mask, we are social distancing, and this is a disease that is spread from person to person in close contact. And so we've been lucky so far this year that the number of cases of flu is very, very low so far. And in fact, we've had no pediatric deaths in the U.S. to date. Unfortunately, last year, we did have 166 children who died in this country from influenza. And even one pediatric death is too many. So again, very important. Children can get influenza. They can die from this disease. And by getting a vaccine, it goes a long way to preventing that from happening. So even though flu is not widespread right now in our community, I can pretty much guarantee you that as the weather gets colder and we're more closely together with those that we care about, that the incidence of flu is going to continue to go up. So I urge you to take this opportunity now and to go in and get your flu shot. We don't really expect the influenza virus to peak until about February. And a reminder that it does take about 2 weeks after you're vaccinated before your body can develop sufficient antibodies to make you protected against this virus. So we don't want to wait until the very last minute to do this. So who should get a flu shot? Anyone who's older than 6 months of age should get a flu shot. But it is really, really important for those people that are high risk. So who's at high risk of having a bad outcome from flu? Well, really everyone, but there are special groups that are even more at risk. And those would be young children, pregnant women, seniors who are 65 and older, and people with chronic medical conditions such as heart disease, stroke, asthma, diabetes, HIV, or cancer. Those individuals are at very much increased risk of having a bad outcome. Whether you belong to any of those demographics, flu can make otherwise healthy adults and children quite ill. And as I said, it can be deadly. So again, we want people to be sure and get vaccinated, including infants who are over 6 months of age. In Westchester this year, we, the health department, have purchased about 20,000 doses of flu vaccine. And we are very busy right now giving flu vaccine in soup kitchens, shelters, and other places where we have people that might not have access to adequate medical care and might not have the ability to get a flu shot otherwise. But there are a lot of private physicians in our community who have the vaccine. There is no shortage of the vaccine this year, and we really encourage you to reach out to your doctor, to the private practice that you go to, and especially get your children vaccinated. And that's exactly what we're here to do today in Dr. Avocado's beautiful office. I want to welcome Dr. Rob Baker, our president of our Board of Health, to come up and just say a few words from the Board of Health.
Thanks, Dr. AMLER. I'm very happy to be here this afternoon as the president of your Board of Health. I'm with my family, my lovely wife Melissa, and my kids Aaron and Sophie. We're a real Westchester family that loves being here in Westchester, and as the president of your Board of Health, I'm concerned that everybody who can gets their flu shot this year for all the reasons that Dr. AMLER outlined. I've had my flu shot already this season. My wife Melissa's had her flu shot this season, and now our kids Aaron and Sophie, as they have every year since they've been 6 months or older, they're getting their flu shots too, because we want to show you by example this is the right thing to do. It's very, very important. You really don't want to get the flu and COVID at the same time, and you really don't want to get either. And while many people know that the flu shot is not 100% effective in preventing the flu, it's nearly 100% effective in preventing you from dying from the flu or getting the kind of severe pneumonias that kill people. So we really, really want everybody to get that shot. I'd like to thank Dr. Avocado and Westchester Park Pediatrics that my kids have been going to actually since before they were born. They were giving us advice on kids when we told them that they were on the way. And we've been really happy here and thank them for their support in this. So with no further ado, Dr. Avocado, if you want to take the stage.
Of course. All right, here we go. Thank you.
Good job, buddy.
Good job. Oh, that's sweet. Oh, sweet. Okay. Nothing like support from your family. So, Sophia, would you and Aaron like to say anything to your friends or your classmates? You want to tell them that they need to get their flu shot? You want to come up here for a second? You can come up here.
I'm really happy that I'm here because my dad is the president of the Board of Health, and he helps us and encourages us to do stuff.
Well, that's very nice. It's a nice thing to say. How about you, Aaron? What do you think?
Surprisingly, I was going to say the exact same thing.
So you just want to tell your friends to go out and get their flu shot?
Yeah.
It didn't hurt hardly at all, right?
Oh, it barely even hurt. I thought it would hurt. I was a little bit scared, but now, like, when I do it, it's like it doesn't hurt at all.
That's great. So that's good news for all those kids out there on TV land, right? Didn't hurt at all. I like hearing that. That's wonderful. Well, thank you guys for being so brave and coming and joining us. We really, really appreciate it. Thank you. So I'll let you have a seat back by your mom. And we want to thank your mom for coming and bringing you here today. Very, very important. And then lastly, I would like to remind all the parents out there that although COVID is important, and right now we are seeing an uptick in our numbers, and we've went from seeing about 30 cases a day to now we're seeing more than 100 cases a day in Westchester. And we are coming up on the holiday season. So really, really, really important when you're planning out your holidays to remember that one of the main ways that this is spreading in our community is in large gatherings. So if you can keep your holiday celebrations small, you'll go a long way to keeping your family safe, because every person you add is an added risk. And so try to remember that. Also, we want to remind people to wear your mask, social distance when you can. You can check out our websites and very important to do those things. And then the last thing I want to remind people is during this whole COVID outbreak, a lot of times it's been very difficult for families to get their children in to see their pediatrician. And as a result of that, our childhood immunization rates have dropped. And it's just a reminder that we still have measles out there. Measles has not gone away, as have a lot of other childhood diseases. Pertussis, a lot of other childhood diseases are still out there, still a problem. So I really encourage all parents to reach out to their pediatrician, make sure their child's immunizations are up to date, and if they are not, call and make an appointment and get in and make sure that your children's vaccine are where they need to be, so that we can make them as safe, not only from COVID, but from all the other communicable diseases that are out there that we now have vaccine. And hopefully very soon, I will be coming in front of a camera to tell you that we have vaccines available. And at that point, I would really encourage, when we do have a safe vaccine that will be effective against COVID, we would really encourage you to get your families vaccinated. The flu shot has proven to be safe, effective, and widely available. We hope that the same will be said of COVID, and that we'll have a vaccine very shortly. So hopefully soon. In the meantime, I want to thank you for joining us today. Thank you very much.